10th. This is the Public Safety Committee meeting. I am Councilor Terry Murphy, the chair of the committee. With me is Councilor at Large Joe McGivern. And on the phone is our also committee member and Ward 7 Councilor and Council President Todd McGee. And also joining us from the council is Howie Graney, who will be on phone, Councilor at Large. And I want to thank all of you for coming. I've invited a number of people. We got a couple of issues that we want to deal with here. And first one, and if I can, entertain a motion, take up item 1, Councilor McGivern.
Make a motion, we take item number 1 off the table for discussion.
Okay, is there a second? Second. All in favor?
Second.
All right. Okay, the first one is item 1. It's introduced by myself, introduced on June 16th. Order that the Public Safety Committee meet with the Director of the Board of Health, representatives from the Holyoke Health Center, including Darren Beek, as well as Jose Bou from the representative from the school department, to discuss any ideas to improve the environment within the 4 lower neighborhoods where statistics indicate the highest levels and severe cases of asthma. Asthma has also negatively impacted school assistance, and a variety of ideas are being discussed. I won't read the rest of the order, but basically we have had a few meetings. We started off just recognizing the impact of asthma in terms of quality of life, in terms of kids going to school, in terms of people working. And I want to thank all of you for being here to offer your input and your assistance here. So, and since our last meeting, and usually I wait about 5 or 6 weeks before I go to a second meeting, but we've had Sarita contacted me with some additional information that I thought could be timely, and we could move the process along, and it relates to fixtures that can help improve air quality in some apartments and things along that line, where a significant, and Darren, this is where you come in, and a significant number of the cases, severe cases, are in the apartments in the lower wards. And so I'm really trying, and I know Yanni's been here working with everybody, trying to work on making sure we get trees that are going to be planted in those neighborhoods that are going to have the best quality in terms of air quality. Sean's been involved, and now we got Alicia Zella from the Community Development Office, and she's here for another order, but I certainly have invited her to participate in this one as well, because I think all of these things can tie in. My ultimate goal with tonight is to make it clear the program. And Sarita, I'm going to have you, and I know you got Colleen coming as well. So I want to have you two. Hi, Colleen. Welcome aboard.
Good evening, everyone. Hello.
Thank you. Go over what your program can be in terms of assisting. And then what I want to try to do, once we get that logistically, is try to make connections with Darren through the Holyoke Health Center, or Sean through the Board of Health, or Alicia or Yanni through the people in the building departments. I'm not exactly sure where we would go to do this, but I want to see if we can start making direct contacts and getting some of these air quality improvements into the apartments for the people that are suffering. So, Sarita, if it's okay, I'm going to start with you because you're the one that had contacted me, and then I'm going to have Colleen, and then I'm going to open it up for questions and comments.
Well, fantastic. Thank you so much. I am really honored to be here and talk with you about the work. I know some of you from the work that we have previously done in Holyoke with the Pioneer Valley Asthma Coalition. We've done a lot of work with the schools. We supported them in getting some green cleaning supplies and doing education of nurses, and really working on the Prevention Wellness Trust Fund. And now we're really excited because we have 2 opportunities for Holyoke that address asthma in different ways. One way is our Healthy Homes asthma program that Colleen and Revitalize CDC is working both with Holyoke Medical Center, and then they have their own community health workers who can support families who have asthma and have had hospitalizations or emergency room visits for asthma, and they can get education and supplies and even home repairs to address that asthma. The other project that we're working on, because we know asthma is an issue up and down the valley, It's an air quality issue. And yet we've never been able to do the sophisticated monitoring that we wanted to do. And now we have an opportunity. And so I was just in a meeting this morning with Yoni and Ryan and some folks from Springfield who are starting a project on air quality monitoring. And this really came out of, it started with some funding from the Attorney General's office to look at air quality and asthma in Springfield. But because we're part of the statewide network of the Massachusetts Asthma Action Partnership, we were able to bring in some folks from Earthwatch who have additional monitors so that the air quality monitoring project can be done from Springfield to Holyoke. And really, it's really fantastic to be able to set up this network of air quality monitors and then be able to track the information. And our goal is to get that information into the hands of folks like you, but also so that residents really understand what are the sources of poor air, of air pollution, and they can also try to avoid that if possible. So our whole goal is to get that information back to the community.
Well, so we appreciate
an overview.
No, that's great, and I appreciate that. And obviously, one of the things I had there way back, I did some reading, and it was GPS trackers for air quality and the impacts. It was like going through different neighborhoods as your GPS would like say this is a bad area, and so we would kind of we'd have Yanni planting more trees in that particular neighborhood or whatever the case might be. So there are obviously some tools that are available. The other tool that I was reading about was actually providing better air quality within the apartments themselves. And
exactly.
That's really a significant goal I would have here, is to be able to provide at a low expense or at no expense to some of our apartment dwellers who have serious cases of asthma. I mean, I grew up in Councilman McGivern. I'm not sure if you grew up in an apartment building. You grew up in a house, right? Councilman McGivern?
Family house.
Family house. I grew up in an apartment and a fourth floor. So I had to go by 8 apartments every day. So, I mean, we weren't bad back then. But, if there's a lot of air quality issues in that building, and you can't maybe do it through the hallway, but we can do it in the apartment building, at least we potentially, in the apartment itself, can potentially improve that person's health and not have them constantly feeling the impact of the poor air quality in the building itself, and especially in their apartment. So that's one of my goals here.
Yeah, so the project that we do, our Healthy Homes program, really combines the education from a community health worker. So first of all, people need to identify what is it that's causing their asthma. Is it the cleaning products? Is it the dust? Is it the pets? Is it the smoking by somebody in their family or somebody else? Is it ventilation or mold? Is it the gas stoves? So what we have are community health workers who can educate people and work with them. They have to use their meds right. They have to know their triggers, be able to avoid those. And if there are things that we can do in the home to fix it, that will save a lot of problems. So that's where we work with Revitalize CDC. And they have home assessors who can go in and assess the building and give supplies that will directly address some of these triggers for asthma. So sometimes it's an air purifier, sometimes it's a mattress and pillow protector, sometimes it's talking to them about how to deal with their pets, sometimes it's figuring out the ventilation, maybe the ducts need to be cleaned, things like that. So those are the kinds of repairs that Colleen and her staff find and get contractors to come and fix. Okay. So we're really excited, and I'm going to turn it over to Colleen to say more about the project.
Okay, if Colleen's as pumped up as you are, we're in good shape. That's a challenge, Colleen.
Yes, I know. That's why I love working with Sarita and the Public Health Institute. We've been collaborating now for, I think, 6 years now, originally from a technical assistance grant from the Green and Healthy Homes Initiative, which is a national network. And as a result of that assistance, we have been collaborating with Bay State Health and accepting referrals for people who have asthma and also COPD. and working on their homes. We also are working with the Be Healthy partnership with the Bay State accountable care organizations, such as Caring Health Center throughout Springfield. We are also that's been going on now, I'd say 4 or 5 years, Sarita. And we've been working with Holyoke Medical Center for a year. So it's been a great collaboration. The Public Health Institute does the planning, the meetings, the scheduling, the convening, the evaluation, and the reporting. They host the efforts to outcomes database that we report into, and then we can report out to our funders too. But it's very important with the community health worker that they work hand in hand with our healthy homes assessors, that the two of them in-house are working together to determine the needs for the particular client, because everybody's situation is a little bit different. And like Sarita said, don't clean with bleach and smoking, addressing those things on the community health worker end, and on the healthy homes assessor end, we're looking inside the homes for anything structural that's affecting or triggering their asthma. And we're looking to eliminate that, or at least hopefully significantly reduce those triggers so that they improve their quality of life, so they're not running to the doctors or the emergency room, and the children are not missing school, hopefully, and the parents are not missing work. So that's really what our focus is. Typical repairs, such as Sarita mentioned, are pest control, mold remediation. We would remove carpeting, for instance, in the client's bedroom and replace that with something like a laminate flooring that eliminates the dust. We provide supplies like HEPA vacuums and air conditioners and air purifiers and mattress protectors, covered trash cans, just to help prevent pests in the homes. So all that type of work it's really targeted and specific for the person that's suffering from asthma. And it's been very successful in this area. And like I said, we're just past year, kicking this off at the Holyoke Medical Center, but we want to just expand our work because there is such a need. I think Greater Springfield has been determined again as another asthma capital of the country. And we want to open that up to other, referrals from other sources throughout the community.
Yeah, one of the connections we have here is Darren Beek. He's from the Holyoke Health Center.
Great.
And he's one of the persons that gave me some initial information, which led me to file the order. And I'm going to let you hear from Darren. And I think it's crucial that we get an understanding just how we get this done, because obviously you have to make connections in an apartment building. I'm assuming you're going to make connections with the apartment dweller more so than the landlord, because I'm thinking the landlords probably aren't going to be as keen. Maybe some will, maybe they all will, and maybe I'm not being kind enough to landlords, but my gut is, the tenants will realize they've got problems and they would invite you. But Darren, and again, obviously we have to maintain confidentiality,
right.
But I think because he's got statistics as to, the number of cases, you might be able to work some kind of coordination, whereas his patients are coming in to the health center, you're in a position to be able to offer some remedy, if you will, that we can come and review what's going on in your apartment, what's causing the problems, and also potentially to provide some relief. So Darren, can you just, if you would be so kind, I know you've gone over, you don't have to go to exact statistics, but you kind of lay out the format like you've done before.
Sure. So we have basically taken all of our patients and geocoded them. So all of the patients of the Holyoke Health Center and the Chicopee Health Center, which is an affiliate of ours, we've gone through the process of geocoding them, and then we have basically created an attribute of asthma, basically identifying that they've had either an ICD-10 code drop for some form of asthma on an encounter, meaning it was part of a visit that they had, or it's on their problem list. So that means that they've had asthma. They may not have it now, but they had it at some point. And we were able to identify, rates at different communities, different areas of Holyoke, what the rate of asthma is among our patients. So it's only among our patients. So if there are a lot of folks living in a particular area that are not patients at the health center, clearly we wouldn't know anything about those. But we identified the rate of asthma in some of these areas as high as 27%, when the national average is like 9%.
Right.
Now, the CDC didn't share their data set, and I've looked for that data set to make sure that we're really comparing apples to apples in terms of how we're identifying them versus how the CDC is identifying them. But I would say our rate is clearly much higher than what they're finding. And so just as we were talking, I just looked overall, and this is not just for kids, but overall at all of our patients that have asthma. And, you know, about, I would say less than a quarter live in a single family home. We also know from our map, we can identify, you know, how many live at an address with more than one patient of the health center. Again, it's just patients, but if we can say, well, how many kids or how many people with asthma live at the same address as 5 other patients? So you could maybe, or 10 other patients. And when we look at just 5 other patients, the number is significant. It's, you know, 2,442 of 3,212. So somewhere more than 2/3 of them live at an address of 5 or more. So we can pinpoint that kind of information. And I've been thinking a lot about how would we measure effectiveness of a campaign, and I guess what we can look for are exacerbations that were brought to our clinic. We wouldn't necessarily know about what came to an emergency room. It would be a little more difficult. We could probably get to some of that data, but we could talk about that if we want to think about how are we going to measure success of any program, which is something that's near and dear to me. Anyway.
Right.
Go ahead, Sue.
Wow, that's really exciting that you have that level of data. And that you've been able to code it that way. I want to speak to a couple of things that you brought up, which is people living in property owned by other people in landlord buildings and larger buildings. Our Healthy Homes program has been open to and wanted to do work in buildings that are owned not by the client or patient. It's a little bit more complicated because we have to go through the tenant to get to the landlord and to get the landlord to sign off on the work. And it gets more complicated if they're not all, depending on where our funding is from. Some of our funding is very limited to a patient because it comes through insurance. So that's where, so we were working on our Be Healthy partnership. It was only patients who are in Be Healthy. So we could take care of their family, their household, but we couldn't do the person next door unless they were also on that program. There are ways to go after the landlords. I'm not going to say anymore because Alicia's here and she might be able to speak to, you know, what to do is that they can, in terms of if there are health and safety issues that could be addressed. Many times, sometimes it just doesn't rise to the same level of something. And also we with our patients, we often ask them, can we go forward with it? And they're very reluctant. They may be behind on their rent. They may have other reasons.
Right.
They may need that housing. There are no other options. So they're very often tentative and unlikely to want to push things with their landlord. So that becomes complicated in dealing with them. That's why a lot of our work with renters is around giving them supplies, because those supplies can help no matter where they live, and they can address some of the issues in the home. But at the same time, our goal would really be to try to address the whole building. So the funding, so depending on how it works, if you had, 4 people from the same building, potentially that could be something that our Healthy Homes that Revitalize CDC could do, but it just, it depends on whether the families are willing and are interested in the services, because we really do want to combine those services. It's not just about fixing the home, it's really about connecting up. And some families are like, I don't want you to fix this up. I don't like my landlord. I don't want to help him, help me, so it's becomes quite complicated in working with rental property if it's not an order that comes from outside, that is really from somebody else pushing that the housing issues. It really
Right.
is much more complicated.
So can I interject here? Let me just, and Alicia, I'm going to potentially look at you on this one as well. So let's just say we had, first of all, let's say there's 4 apartments in an 8-unit building where we know there are cases of severe or asthma or severe asthma. If those 4 apartment units, or one of them, or maybe only one of them, decided they wanted to get your assistance, are you saying that you're prohibited from going into those buildings? You're not saying that, right? Okay.
That's not what I said. It's whether the person wants to push it with the code enforcement.
Okay.
What we find with the renters is that they're in a typical situation very often. They don't have another place to go. They want to keep good relationship with the landlord. They may not have paid rent all the time on time, so they don't want to push anything when they might face retaliation. Even when we have had a legal assistance, so we had a medical legal partnership, even when we have the medical legal partnership, patients will sometimes listen to the legal advice and appreciate that advice, but still may not want to fight with their landlord.
But if the tenant did want you to come in and go into the apartment, and obviously you can't go into the hallway if the landlord is not allowing you to check it out, but you could go into the apartment since the tenant's renting it, that they could at least have a chance to have you review and make suggestions as to what you might be able to do in that apartment, right? It would just be in that apartment, not in the whole building as a whole.
That's right.
But at least for that family, potentially it would be improved.
Absolutely.
Okay.
Absolutely. We definitely do that.
Okay. And again, I think the connection, and Sean, chime in anytime you want here, okay? But the connection with Darren and with your 2 programs, to me, has a lot of potential without, providing freedom of information and telling somebody's health issue. If we could do it as they're coming, and now they see that you're offering that potential asthma educational and supply relief, if you will. I don't know how do I describe that, but that was pretty good off the top of my head. I think that would be a connection where, I mean, if we have the 900 cases in I think it's in Ward 2, if I'm not mistaken, South Holyoke was like 900 cases. It was a phenomenal amount of cases. If we could, deal with 200 of those, then obviously we've made a significant impact on health quality in the community, whether the landlord goes along. Now, my next question goes to Alicia, and that would be, if we were in a position, Alicia, to have some community development money to go to landlords to improve the air quality in their apartments, would that be one of those eligible expenses?
So good evening, everyone. We actually, the Community Development Office has worked with both Sarita and Colleen on a few cases over the past couple of years. And Colleen has actually applied for, I think it was about $250,000 of Healthy Homes Fund in the past. And so the short answer is yes, Terry. If we had a landlord that needed to have rehab work done, so mold remediation, lead-based paint remediation, weather sealing, properly installed doors and windows, improved HVAC systems, leaks. One of the big things is mold as a result of leaking roofs, leaking doors, leaking windows, not weather tight properties, then we absolutely could use CDBG funds to make those repairs.
Okay.
And we actually have an open enrollment revolving loan fund that could take applications tomorrow. That program is open enrolling. It's the Rental Neighborhood Improvement Program. It's well funded. Typically we do it with the landlord as a revolving loan. However, depending on the circumstances, we can make exceptions and sometimes do it as a grant. I would mention 2 pieces. One is the reluctance of code enforcement. So and I'm glad Sean's here, because I really think that if you have a tenant who's living in a unit that has code enforcement issues, there can be a carrot and stick approach where the Board of Health really should be going in, or the building department really should be going in and issuing citations. But at the same time that the citation is being issued, there's also a handoff of information from the grant programs. And so the landlord's not just being hit with a citation for mold or a leaking roof, but at the same time also being provided with the information and a relatively easy process to secure funding for those repairs.
Yeah.
And the other piece that's so critical there is so many of our families are on either a Section 8 voucher or an MRVP voucher or some other kind of subsidized housing. And all of those subsidy providers require a minimum level of housing quality standards. And so if Sarita and Colleen are finding families that are living, or Darren at the health center, if you're finding families that are living in substandard conditions or have issues like lead-based paint or mold or rat infestations or whatever, not only is it a violation of perhaps Board of Health requirements or building requirements, it's also a violation of the subsidy that they're currently being provided for safe, suitable housing. That landlord is collecting the rent with that subsidy payment. And so that landlord needs to be keeping the units at a minimum housing quality standard. And so we really encourage tenants to reach out to Sean and the Board of Health. We had a really complicated situation on Maple Street. I won't go into a lot of details, a really complicated situation, multiple households, and we were able to navigate and get those repairs made and get the families in much better living situations. So yes, funding is available. It would be available tomorrow if you called me and said we have units that need to be rehabbed. CDBG cannot be used to pay for items that are going to be used by an individual household. So things like mattress covers, vacuum cleaners, cleaning supplies, we can't pay for, but we can pay for the rehab work. So HVAC systems, windows, leaking roofs, air quality improvements on the boilers or whatever, anything that Sean might identify as a code enforcement issue, we're likely to make loans and grants for those repairs.
Is there a dollar limit on the grant or loan?
So the program cap is $21,500 per unit. But again, per unit. Yeah.
So some apartments could get $170,000.
Mm-hmm.
Wow.
Yep. But these are usually fairly low ticket type items, especially when you're, if we're talking about leaks and that kind of thing, it's not necessarily always big money. But we absolutely have that funding available. You can call me tomorrow if you've got a case that you're working on. And like I said, the carrot and stick approach with the landlords, sometimes it's not even getting to the level of a citation, it's bringing it to their attention and then offering them the opportunity to get funding to fix it.
Okay, so, thank you.
And this is only landlords, correct? Not homeowners at all?
So this is going to be only, so the rental neighborhood improvement program is going to be landlords only. If you have cases of owner occupied, we could probably do them through the neighborhood improvement program. We do have a waiting list, but if you've got a roof that's leaking and we've got a medical note that this is, the property either has to get fixed or they're going to have to vacate it because of the health issues, we could make that a priority case. Yeah.
Thank you.
So,
Sean, would you like to address this?
Yeah, I would say on my end, no challenge going in and doing the inspections. I think for us, what would be the most helpful is if, Darren or Sarita or Colleen or Alicia, if we sort of know ahead of time, or we can sort of coordinate that, we're seeing some issues in this unit, they're going to reach out to you. And we can kind of standardize an approach. I mean, inspections that we do are sort of predicated on the comfort level of the people whose unit we're entering. And sometimes they say, look, I just want you to look at this one thing, and then we don't want you to do anything else. We want you to leave when you're done. And that doesn't always give us the opportunity to sort of look at the entire picture. But if we're aware ahead of time that maybe there's a larger issue here that's not just a leaky ceiling, that maybe there's some other issues coming into play, we can really shape the inspection to fit that purpose, and we can do a little preparation beforehand because we know what we're looking for, and that might help make that inspection bear a little bit more fruit. I think the other half of that is maybe working with the landlord, on our end as well. Sometimes landlords are a little reluctant. They want to get things done right away, and they think they're just going to send a handyman in there to, hang a little drywall or something, or put some paint on, and then ta-da! And opening things up to take a good look and resolve air quality issues, say in a ceiling that has mold, or underneath a sink in a cabinet, is a little bit more involved, and having the coordinated effort to walk them through that process. It'll take a little more time, but we're willing to do it for sure.
So if Darren was able to provide you some statistics in various areas, and I know several of them would be part of my ward, where there's a significant number of tenants in that building that are suffering from asthma in different apartments and different families, that would be an incentive to go take a look at the building and see what could be done. And also then you'd be in also the position, if I'm hearing all of us correctly, and I hope I am, I'm very optimistic here, that we would then be in a position to coordinate with Sarita and Colleen and Alicia, and potentially work with a landlord to say, we're going to help your tenants have a better quality of life, and it's going to be at a low cost to you, and we're going to be able to provide you this kind of expertise and incentive. Am I hearing that correctly?
The tenants would have to let us in. I mean,
Okay.
So that's the first part, is we do need permission to access the units. Even if I had the information, if the tenants were not interested in allowing me to enter their unit, sort of the buck stops there, unless there was some sort of emergency situation that demanded a little more. But if there were people who were willing to let us in and take a look, especially if there's multiple people in the same building that would let us in, that would really allow us to build a case that, hey, some improvements might be necessary across the board. Maybe we should take a look at some of the common areas in the basement, or a broader inspection. And then certainly we could forward any relevant findings to anybody that needed it and help negotiate with the landlord.
Okay.
So in terms of Darren making referrals, my understanding of the HIPAA laws is that it would have to be with the approval of the family, with the consent. And we have a data system, the efforts to outcome system, where it could be all HIPAA compliant and secure, so that we could get secure referrals and make sure that that happens. But it might be complicated on Darren's side to be able to give us all 4 of the people in the same building. I'm not quite sure how that works with HIPAA.
Well, I've jotted a note down to talk to our compliance officer regarding this. But my thought would be, there might be a way to say, we know that 10 of our patients have asthma and they live at this address. And does that violate HIPAA to give that information at a generic level without giving you names? And is there an opportunity to then outreach directly to the building owner rather than each individual tenant? Is that a possibility? And then basically the building owner would have the opportunity to outreach to the tenants.
I don't think, Darren, that that's a HIPAA violation. I think for me, the challenge would be if it's a 20-unit apartment building and we have 10 units in there. I can't speak for every landlord, but I don't know how willing some landlords would be to give us carte blanche to go in every unit and sort of look for issues. Because it's a little bit of a ball of wax that you're unraveling there.
I think it's usually easier, at least from our experiences, I'm thinking, and correct me if I'm wrong, Sarita, but if it's coming from the tenants first to before going to the landlord,
But to Sarita's point, the tenants are, especially if they're behind in their rent or they're already feeling marginalized, they are not going to want to raise any red flags, right? And so that's why I'm just thinking creatively about how do we go the opposite direction? Let the landlord be identified first, and I don't know, maybe just a thought.
It's
Darren,
not always
on my end would be, if maybe on a smaller scale, you know, we could have a Zoom or a phone call with Alicia and Sarita and myself and yourself and Colleen. And what we could do is, why don't we take a look at some of these buildings that you've identified that have multiple affected folks in them, and let's take a look at, you know, what the ownership looks like. And there may be some people that have a good relationship with the city where maybe we just give them a phone call and say, hey, we've noticed a trend in one of your buildings. Would you be interested in this process? And if that works well, we could take the findings from that and we can carry it over into other buildings.
Yeah, I like that idea.
I do too. I like it also. You know, I'm just prefacing that I first need to run it by our compliance officer to make sure that we're not violating any sort of HIPAA rule. But it seems like it might be removed enough that it wouldn't. But I need to verify that.
But especially if we have pretty good relations with landlords already, and now they find out, you know, that there's some health concerns there, and they've already got a good relationship with the city, they might be much more, as Sean said, more willing to say, let's go try to resolve this. Let's use your help. Let's get you in here, and then work to resolve it. Obviously, long term, they get tenants that are happier and healthier. So that's probably a good thing to have in the building. And I do think that's a good next step to take in this process, if we could. If there's financial needs on it that we might be able to provide beyond the rental neighborhood improvement program, if there's something else we need to do. And then the other aspect of that is, if we don't have a landlord, I still would like to see not necessarily a tenant complaining, but a tenant working with you and your programs to at least go into their apartment and see if there are things that you can provide those tenants to at least improve the quality of the air in their apartment. And if we just do that, that's obviously, if there's eight apartments or 10 apartments and we get one done, well, at least that's one that's done. And it may not be as perfect as we'd like it to be, but it's better than what it was. But I'd like to go on both of those aspects if that's possible. If you think we can, you all seem to like the idea, and I think you can coordinate. Yanni, you got any other thoughts on this? I know I appreciate you coming again.
Sure. Yeah, we had a great meeting this morning to talk about the air quality monitors. I know these are both very encouraging opportunities. That's something I see my office working more closely with. One thing that was really interesting was the idea that once these monitors, even before the monitors get placed, there has to be a process to figure out where they should go. Trying to find the right locations to get a balance of different neighborhoods to really pinpoint the major air pollutant sources. And in Springfield, they're doing, through their MVP grant, the Regreening Springfield is leading a community engagement effort to inform the public about the project and gather feedback about good locations, and simultaneously get information to people about their free tree planting program. So one thing we're thinking about partnering with for this project is our current MVP project that I'm managing for our urban forest equity plan. We're also going to have community forums later this month to get feedback from community stakeholders about their priorities for Holyoke's canopy and ways forward. And we just had a meeting later today with our consultants, Davie Resource Group, who are putting the plan together and doing the research. We're thinking about what to include in these forums and how to structure them. And now we're thinking about how we can weave in the air quality conversation as well. Okay. And sort of start that process and, be a part of it going forward. Okay. So,
Mr. Chairman.
Yes, Councilor Rainey.
Yeah, this is a very complex issue. I'd like to ask the experts if there is any universal product, whether it be air purifier, some type of vegetation, some type of plant that could be grown in the house or in the apartment or something like that, that would alleviate the situation immediately, something that's inexpensive, something that would give these people who are suffering from asthma relief immediately. Something inexpensive that's universal, that affects, that would be effective against all forms of asthma.
I think the supplies are immediate. I mean, obviously the repairs and interventions are immediate once they're done, but I think the air purifier is probably the number one item. But with the climate change, we're finding air conditioners are in need, but simple things like the mattress and pillow protector covers, eliminating dust with the HEPA vacuums, that combination of supplies, green cleaning supplies, that combination is just, we deliver, we educate the family on the use and proper placement of them, and it is immediate from the time that we introduce that to them.
And immediate in terms of improving quality.
So there are, I mean, inexpensive products. I don't know, dehumidifiers or something, some kind of inexpensive product that would alleviate the situation that we could, that certainly could operate through the Holyoke Health Center to people that have this terrible disease, and hopefully to alleviate their suffering. Something that can be done, not 2 weeks from now, 3 weeks from now, but at the next meeting that they go to the Holyoke Health Center. I know it's a complex issue and it's very complicated, but tomorrow somebody's going to be suffering from asthma, and I'd like to see if there was something there that could help to stop that suffering. That's all.
So
if I may,
Councilor Greene?
I think one of the things that has come up is that there are many different sources that trigger asthma is not caused by like a singular source. And I don't mean to, you may already be aware of that, but in some units it could be that the house plants that they have in the home are the cause, or it could be a pet, or it could be a smoker down the hallway, or it could be a high amount of particulate matter in the air in the neighborhood they live in. And so it may not always be that there is sort of a one immediate thing that they can do that will change that. And many times it's about teaching people how to change maybe some of the way that they operate day to day, or some of their behavior patterns, opening and closing windows, or not opening the window during certain times of the day, or maybe getting rid of a pet or a different sort of pet or different plants. And so I think it may not be as simple as saying, if you put this in your home, it will alleviate asthma symptoms immediately.
So it sounds like one of the things we really need to do is try to get people into the apartment to kind of review what's good, what's bad, what can help you. And then if we can get that point, then we can potentially do some other things and work with the Holyoke Health Center. Maybe now we've got people that have gone and found out they've got things, and now Darren's getting results that their asthma level is dropping, and now we know those things work, and now we can convey that to maybe some other patient tenants without giving up any HIPAA law.
Right.
Dr.
Darren?
Liao was not able to attend tonight, but it is a question I think that we brought to her the first time we met.
Yep.
When we were just talking about, could we just plant some trees and would that help? And I think the one thing we do know is I love trees, and I've made a lot of efforts to plant trees wherever I've lived. But for the people that are suffering, I think she would say that most of the problems her patients are seeing are due to things in the home, and not necessarily from outside. It's going to be interesting.
Specifically in their apartment?
Yeah,
okay.
Yeah. Versus, just in the environment, and especially this past year, there's probably been more exacerbations. And I say probably because a lot of people, I think, are suffering in silence this last year. We're not, we have patients that we're not seeing because they're getting behind in their vaccines, and other things because of COVID. It's really keeping them at bay. Parents are really anxious, so they don't want to go take their child to get their shots and to get checkups, and they're kind of just like dealing with it as much as they can at home. So it'll be interesting now that as things open up, and also Dr. Liao is working as the medical director for the Holyoke Public Schools. So I think that that relationship is probably going to be pretty informative for her also.
Yeah.
So I would be not be surprised if that brings about, you know, some more information.
Chairman Murphy?
Councilor Graney.
Yeah, the reason I ask is I had a niece passed on at 44 years old. It didn't make it to the hospital on time, suffering from asthma. She wound up in a coma at the Western Mass Hospital for 3.5 years before she passed away. So it's a dread disease, and if it's not treated, you know, as soon as possible, it can be fatal. So it's something that's very near and dear to my heart. I'd love to see something out there that would help these people.
Yeah, I wholeheartedly agree with you, Councilor Graney, and that's why I keep getting more and more expertise coming in here to try to put a plan together so that we can start to reduce the numbers in Holyoke and get, again, it originally started, my first contact was with Jose Bou from the school department telling me how many students were missing school because of asthma. Because I went to it was part of the attendance meeting starting in 2019, and it was like a significant portion. And we got to find a way. And at first I was thinking, is it because the schools weren't good? But it appears that it's more the apartments, and obviously based on Darren's statistics, it certainly looks like it's the apartments. So it
can be a mix. It can be a mix. I think that one of that what Sean was saying before is absolutely true. It really does depend on the particular situation. And it's really important to think about the indoor air quality. What is the air inside the home, but also about the air quality outside the home. And the fact that we do have, we are in a valley, we do have exposures here in this area that are important for people to understand whether or not that is actually causing the asthma that then is exacerbated by the things that are in the home. So I think for everyone, it's a combination. So I would say we could work on the air quality monitors so that at least if nothing, we rule out what is the outdoor air, and then we work on the indoor air at the same time. And I just want to say I'm here to support both projects with Holyoke because we've done a lot of work with the schools. We can do more and keep going on, but we're allies here with the community, and we've seen, and I am so sorry to hear of Councilor Greeney's niece. These are stories I've heard often, and no person should die from asthma. There are medications. This is something that's preventable. It's not curable, but it's preventable.
And we can make the quality of life that much better. So, and that's the goal. That's the goal of this order. And we, if it's okay with the committee, Councilor McGivern, Councilor McGee, if it's okay, and you let me know if it's not. We've got 7 experts here that I think have agreed to kind of get together and have a Zoom to kind of develop a strategy that we can try to implement in the city with those people suffering, and maybe try to clean up some of the buildings. And if you're all in agreement with that, I would table this with the idea that we would come back in probably 3 weeks or so, just to kind of see where we've gone and if we've made progress in actually starting to identify where we're going to go and how we're going to get there. Would that be okay?
I'll
make a motion to table.
Yeah. Before I second that motion, Councilor Murphy, I'd just like to thank everyone for joining us this evening. A little quiet, but I've taken in everything, and it's incredible, the collaboration here, but the partnership that I think has been formed and the resources that looks like they've been there all along, but now they're coordinating, and I think it's great. But I have no problem with Councilor Murphy. That's your wishes. I second Councilor McGee's motion to table.
Okay, so the motion is made to table. I'm just going to thank you all again, and I appreciate your time. And I know I keep inviting you back, and I'm going to invite you back again because I want to see us get to the point where Darren, you're telling me we have the same number of cases, but they're far less acute. They're missing far less school. The air quality in that, and we're not having any new cases coming from that apartment building or that apartment building. And again, I mean, obviously the goal here is to give every person a place where they can live and live with health and comfort. So I appreciate all your willingness to work together. We're going to table this. I'm going to bring it back in probably 3 weeks to 4 weeks, get you all back again and see where we're looking at that point and what we've kind of moved forward with. So thank you very much. I know a couple of you are still here for the next meeting. So,
thank you.
Alicia,
thank you.
Everyone
Thanks
else,
so much.
thank you very much.
Okay.
And motion on the table. All in favor?
Aye.
Aye.
Opposed? Okay. Thank you very much. I'll introduce a motion. I'll entertain a motion to accept item 2.
Motion to take up item 2.
Second.
All in favor? Aye. Also
Aye.
introduced by myself. It's ordered that the mayor and the health director appear before the public safety committee to provide an update on the potential for the city to establish a homeless shelter, potentially for the War Memorial Building. Let me say, I got a note from the mayor saying he wasn't going to be able to make it, but I want to thank Alicia Zeller, who has stepped up and provided some information. I want to thank Sean, who's been at the forefront of what we've been discussing here. And so I don't know which way you'd like me to go, Sean or Alicia, whichever one first. I don't care.
Alicia, do you want to go first? You brought some information, so.
Sure. I think my information is more is a little more general, but I did want to let the committee know that as of this afternoon, we were notified that there may be a special allocation of home funding. And I use maybe in caps and bold because we haven't had a chance to make sure that this is completely accurate, but there may be a special allocation of home funds awarded to the city for specific purpose of addressing homelessness and homelessness assistance. And that would be coming to us from HUD, the way our other home funds come and flow to the city, but it's tied to the bill that is currently, I believe, is now sitting on the president's desk. And so we'll have some more information in the coming days if those funds actually will be coming or not. And so that will probably help shape the conversation. We also, the Community Development Office did make a request from this year's CDBG allocation for $65,000 in the public service category to put towards homeless services, that sort of thing. And then finally, and I think Sean can probably expand on this, the city is currently sheltering between 45 and 49 people at Motel 6 in coordination with, and I say the city, but it's the city from a geographic perspective, between 45 and 49 people at Motel 6 in coordination with CHD. They have a contract with the state. We're hoping that that contract will be extended through September. And those folks at Motel 6 are actually receiving just the model that we want, which is wraparound services, assistance getting their IDs in order so that they can fill out rental applications. They're being provided with assistance to transition to permanent supportive housing or permanent housing. It's in coordination with the Holyoke Police Department, narcotics squad, I believe, so that any concerns around narcotics use are being addressed. But it's the sort of model that we want, that folks are in one place, they're appropriately distanced, social distanced, they're safe, they're warm, they get food, they get counseling, they get services. And so if we're thinking sort of continuing that, that's the sort of model that I would certainly advocate for, is that those wraparound services, because that's what's so critical. Otherwise, you're merely putting a roof over someone's head every night and they're not making any progress in their living situation. So I think that's all I've got for now.
100% agree with that, Sean. I'm going to ask Councilor McGivern. I know he's got his hand up, then I'm going to get back to you, Sean, okay?
Councilor Murphy, and I'll reserve my comments for a little bit, but can we define, you as the maker of this order, define or give us a definition for what you're seeking in terms of, and what you're describing as homeless?
Well, it would be in my order, and what I'm trying to do is, we have had Sean in before, and we were talking about those people that are without a residence, I guess I'll call it, that were looking for shelter, primarily in the winter, from what I'm gathering, but that's not necessarily what I'm looking at. My goal would be something like Alicia has just talked about, where someone would we would provide that, but we're also going to provide a connection to getting out of homelessness. I don't think it's good to establish something where we're just going to continue to revolve like persons from coming out, going back in, coming back in, with the goal of providing shelter and also providing some other services to try to get them a better quality of life. And obviously, we're trying to get them a better quality of life by getting them into a homeless shelter. I also kind of viewed it as I filed it because the original talk that we had was on the War Memorial Building, and I had concerns about that, about trying to get something that would be structurally independent, that we could maybe work with a nonprofit to work and handle. So that was my thought.
I appreciate that. I just want to make sure that we're on the same page. As always, noble goals, noble gestures towards a serious problem. The one thing in the definition that concerns me, and what Alicia just described, what I know, and what you did not describe, is who and where the homeless are coming from. We've become a magnet. Motel 6 is not people from Holyoke who are homeless. We lost a Holiday Inn because the state put homeless people as far away as Boston into our Holiday Inn itself. You know, in the police department, I understand working with people who have drug issues. That's a little separate from homeless. You know, there's a big difference. CHD, Sean, do we have a number of units that currently occupy apartments, you know, both by CHD and other agencies, you know, within the city of Holyoke?
No, I don't, and they're not necessarily required to disclose that.
No, I know they're not, but we're talking hundreds of apartments.
I would say so,
Some of these apartment buildings are being taken off the tax rolls. We are not the city, a social service agency. You know, we need to start sticking up for what we need to get our budget back on our feet so we can provide the service for the residents of this city and not the residents of Boston that need a place to live. You know, the state have beaten us up on this issue for years now. And it's time to stand up again, because I thought we stopped it. I thought we stopped putting people into shelters and hotels and motels that are, you know, the Holiday Inn was the flagship of the East Coast. Outside of the big cities, it had the highest occupancy rate before it became a homeless shelter. Now it's gone. So let's be real here. Let's talk about something that, you know, I'm not against helping people, but bringing people into the city because they're homeless does not make any sense to me.
Yeah, sorry. I'm not trying to bring, and my order is not to try to bring, and I wholeheartely agree with you.
Jerry, I didn't say that was your order, but that's what's happening.
Yeah, no, I understand. I just want to emphasize, though, I totally agree with you that we should not be having people coming from the eastern. With 1 second, Councilor Graney, okay? I think that was you, right? I'll be right back to you, Councilor Graney.
Okay.
I totally agree that we should not be having people coming from the eastern part of the state to come live in an apartment building in Holyoke. I mean, that just makes no sense whatsoever. But we do have cases. I mean, I know we had cases with people homeless by the dike and underneath the river, and you know, I mean, clearly some of them are probably not people that want to get some shelter, and I don't think we should use it. My goal would not be to be using taxable for-profit entities to be able to do that, but to create an opportunity where someone has a chance to change their life.
That's exactly what is happening, and the state promotes it. I visited people on the other side of the dike. And I know the ones that lived from Holyoke. I know the ones that came from elsewhere. And the reason they came from elsewhere, we both know, is what the police are trying to combat, but is the sale of drugs in the city of Holyoke. But there are family shelters that are well run, but there are families that get on a list in areas as far away as Boston, and when the list opens up, they have to take the apartment in Holyoke, and they come to Holyoke, and good for them, not good for Holyoke.
Yeah, and again, I don't think it makes sense. Councilor Graney?
Yeah, Mr. Chairman, I concur completely with what Councilor McGivern has said. The Holiday Inn had, I believe, was the first time I was on the city council and we discussed this issue. there were some 122 police calls to go to the Holiday Inn, which was housing, homeless people. There was drug activity. All the businesses in the area were affected by that. To me, this is a situation that it seems that everybody looks at Holyoke because we open our arms wide open to everybody to come on in and enjoy. But we have an obligation to our taxpayers, to our citizens, to keep this, to try to straighten out this city, to try and clean it up, to try and make it better for all citizens. And I understand and I'm empathetic toward the homeless people. God willing, all of us are a paycheck away from being homeless, but there are other problems that are involved here. And we're taking people from other communities, from other areas into our city, and that's just wrong. I cannot support anything like that. It just does not make sense for our people, for our taxpayers, who plenty of our own residents and people, they're struggling day to day to make any, to exist. And this has to stop. We need to get back to the basics, looking out for our own people, our own residents. That's what we need to do. And the War Memorial, I have a real problem with. That's hallowed ground. I could understand housing homeless veterans there, but anybody else, no way. Thank you.
And again, the original intent there, and Sean, you correct me if I'm wrong, was just to try to find a temporary facility to get people off the streets in the middle of the winter.
Well, so all this kind of flows into, there's a lot of different angles here, and I'll try to hit some of them. But I think to Councilor Graney's point and to, Councilor McGivern's point, Holyoke has a location problem. And that's what I'm going to say about homeless shelters is for a variety of reasons. And for different people, there are different reasons, but people don't want a shelter near a school. They don't want a shelter near their homes. They don't want a shelter, too close to certain other businesses. And what happens is the very first thing that we need to make a realistic plan for a shelter is a location. And I don't know that there is a location in the city that right now we have earmarked that is available, that makes sense space-wise, and that we have some sort of control over any foot in the door on. There may be spaces, but those spaces would be something that the city would have to negotiate to use like any other person seeking to lease a space. And, to Councilor Graney's point, during and after the Dean School project that we had that was later scrapped, the War Memorial Commission made it very clear to me that they were not interested in having the War Memorial Building be a shelter for any longer than, an overnight emergency situation. So, we've used that as our emergency shelter, and they have no qualms with that. But the commission is not interested in having some sort of, even if it is temporary in the sense that it's only a few months, they're not interested in that at that facility. And if the school committee or other members of the community don't want it at a school, I honestly don't know where we would put it. And I think that really hampers any efforts moving forward, is that there's a public perception issue with homeless shelters. And I'm not here to argue whether or not those concerns are valid. I think that that's very much dependent on the individual situation, but people see that they perceive that it's going to lower their property values, or that it's going to cause some sort of a crime issue. And I think when we discussed the Dean project, the fears that people expressed were that they didn't want the building to become an area where there was high crime, or that was drawing illegal activity, or they felt that it was going to attract people that may be dangerous or bring an undesirable element to an area where there were children. And I mean, that's a very common stereotype and sometimes a misconception about every service that's rendered for people who are housing insecure or homeless. And I don't think that a shelter necessarily has to be any of those things. And I think that a well-run, well-organized shelter cannot be a danger to a neighborhood, and it cannot be a burden to the area. But you know, when we think about Friends of the Homeless, it's a well-respected, well-run operation in Springfield, and you know, they would have brought that here, but that sort of temporary operation has limitations. And I think, you know, it didn't get off the ground here because it was temporary, and by the time we would have sorted through a lot of the issues, it would have been a very, very narrow run, and then, you know, the public didn't receive it well. If we're going to have a homeless shelter, and you know, hearing the other concerns about the controls over who accesses that homeless shelter and how resources are managed, if we had a real shelter that had a full-time staff and had coordinators and had counselors and had people there on a daily basis doing casework, you would have more control over what happened there and who had access to services. And it wouldn't necessarily just be the state sort of bringing people into apartments that they rented wholesale in buildings, which, you know, that does happen. They rent half of an apartment building and they set up those individual units as a shelter. So if we had a real shelter that had coordinators and was not an ad hoc facility that the state was, or the city was just sort of cobbling together temporarily, you could address some of those concerns and issues on a regular basis, and the city would have input and you could have meetings. But if it's, and I don't mean to be critical of the effort, but if you have a temporary facility where it's a bunch of city departments banding together with state agencies that may not always see eye to eye, the level of control and the level of development that you would have there over time is going to be, you know, it's going to be a lower threshold. So I just think there are some obstacles that we need to overcome before we can realistically do this. And the DHCD MEMA plan that we had really was like, it wasn't exactly this, but they pretty much said, find us a location and we'll come here and we'll unpack a shelter and it will open. And that's no longer on the table at this moment. Alicia said that there may be similar funding that could bring a similar situation around, but I really think for this to be successful and to alleviate some of the concerns that have been expressed by the public and by counselors, there needs to be a qualified, dedicated person, at least one to start, to get this off the ground, to be aware and be well-versed in the issues that arise and to manage them and to meet with stakeholders and community members and address them and then work through that so that we don't get rolling and then halfway through find out that there is, you know, serious concerns or that someone's going to reject that location. And I think that that's one of the ways that we've struggled in the past, is that we tried to do this through sort of a collaborative effort of everybody pitching in and everybody giving a little bit of their expertise. And I just think there are too many oversights and sort of chinks in the armor there for that to be successful.
Okay, thank you.
Mr. Chairman, just a quick comment.
Councilor Graney and then Councilor McGivern.
I could name probably 5, 6, 7, 8, maybe 10 communities that surround Holyoke or within a 30-mile radius that have done nothing for anybody that would be beautiful locations for homeless shelters. But they refuse. They say no. And we always say yes. It's about time that we started to say no and we started to take care of our residents that are living in our city. Thank you.
Councilor McGivern.
Yeah, I just want to clarify my comments and spell it out as best I can. You know, Sean, it's not a neighborhood, not in my backyard type situation. It's my backyard. Our backyard has been saturated with this. You know, there are shelters currently, and CHD runs a shelter, start on 288 Oak Street, go down Oak Street to Sargent, go around to Beach Street to the Beechwood. 55 family apartments with 2 families per apartment are taken up there. Okay, CHD runs 3 other shelters, not the same size, on Sargent Street, Elm Street, and one other one down on, I think it's on Pine Street. Providence Ministry runs some wonderful programs, well done, for people who have substance abuse issues and don't have some place to go. It's sober living, but it's also a form of sheltering people who are battling substance abuse issues. They don't put them alone in Motel 6. They put them in strict environments where it's, you know, make a mistake and you're out. And it's the type of service that we need to see to be well run. But these are in every neighborhood of the city. How many group homes does the city of Holyoke have that come under the umbrella of an educational facility? We see them everywhere. We know the one that's getting all the headlines, but that's nothing. I mean, they've been in every neighborhood of the city, from Northampton Street down to Main Street throughout, and many of them well run. We are oversaturated. When is enough of the not-profit stuff that's taking away from our tax base? And Councilor Murphy said the smartest thing I heard this evening is, when are we going to start doing something to break the poverty cycle, to get people out of homelessness, put them to work, and give them places where they can now become part of the tax base and become part of the community? That's what I want to hear. Not bring more people in who need shelter. Not put people in a hotel who, I mean, I'm telling you right now, the neighbors of that hotel, I'll tell you what's really going on up there. And I'm talking about residential neighbors and commercial neighbors. It is a major problem of saturation. It's time it stops, and it's time to state, let's Holyoke alone and let's us rebuild.
Mr. Chair, one other quick comment. Within 4 blocks from my house, there's a shelter. There's a place. And most of the cars that are outside there, and I go by it every day, they're from Connecticut and different places like that, the counselors that are coming into that group home. There's no problems with it. I have no problem with it. It's wonderful. But we've done enough.
Massachusetts accepts homeless families from other states. I visited one at the Holiday Inn with my career job. And believe me, I mean, I'm not against taking care of a homeless family, and they were in need. But we took a homeless family from Florida. Will someone tell me why we are the magnet and why we continue to do this?
So I think I should clarify my position, and I think in both cases, Councilor McGivern and Councilor Graney, I think we're talking about similar things. But so when I'm using the word shelter, I'm referring to a drop-in shelter that can address someone who, say, so I respect both of your points, and you are correct. The shelters you are describing, which are like transitional housing or housing assistance or long-term housing or a variety of program-based housing, those are all over the city. You'll get no disagreement from me, and I agree that Holyoke does have quite a saturation, and as I said before, they don't even necessarily need to disclose to the Board of Health or other agencies where they are. So we can't even necessarily keep track of every shelter until maybe we get involved because we get called there. Sometimes we stumble into them. The shelter that I'm discussing is like a drop-in, no strings attached. You do not have a place to sleep tonight. This is a roof over your head, a meal, access to services. So I guess maybe we're both using the word shelter, but I think we're describing different settings.
The assessor's office, they know right away, because the assessor's office are notified as soon as the entity running the program don't want to pay taxes.
Alicia?
So I think that Sean made a really good point. The shelters, we'll use the word loosely, that predominantly families are living in the apartments. The families are there because they've gone through a rigorous screening system, usually with the state, and they were placed in those units. And so I think it's important to keep in mind what Sean is referring to, that the shelter that we're discussing is the drop-in type emergency shelter, because every night in the city of Holyoke, we have dozens of individuals and couples living on the streets. They're staying in our parks, they're staying on the riverfront, they're staying in places that are not fit for human habitation. And so that's the sort of shelter that we have heard from providers that are working in the city that needs to be located within the city itself. And in terms of other communities, I can assure you, and I'm happy to get some additional information, that other communities do have similarly situated shelters. Amherst, Northampton, there's Craigslist, there's many emergency type shelters up and down the valley. But every night in Holyoke, we know dozens of individuals and couples, not families, because families are typically able to get into the system, but we know that there are individuals bunkering down under the highways in our parks. And those are the intended beneficiaries and the intended clients for this sort of shelter, a place where they can go, and we know that on a cold winter night that they're going to be safe. And ideally, this is a self-defeating model in that if you get folks in, you get them on a housing pathway, you get them the services they need, you start to dwindle the numbers as people move into either permanent housing or permanent supportive housing and get the services that they need. Ideally, we would put ourselves out of business.
And that is what my view of what we're trying to do would be, is that you're coming, you're getting them, if you will, you're getting a connection, getting maybe a better understanding of what the problem is, and obviously it could be a variety of things. And some of them, I know the police department has said that trying to get people into a service, and if they came into a shelter, and maybe they could get them into some programs, obviously housing, job training, all those kind of things that would potentially. And the other factor, and I don't know if they were originally Holyoke people, but I know, as you say, that they've been sleeping in places in Holyoke where you're not supposed to be sleeping. That also makes it dangerous for kids who go to places who, when I was a kid, I hung out in places that I know right now I would not go because of the situation in terms of what's there. So, I mean, there's no easy answer. And I know, Alicia, I appreciate all your statistics, and I think you were estimating 6 or 7 employees. It would be a nonprofit that would run it, or that would be the suggestion, and that there would be connection to try to get, you're not coming here for 6 months, you're coming here for a couple of nights. We're trying to get you connected to where you need to go to get your life back together, if I'm hearing you correctly.
What's been the success at the Motel 6?
Alicia?
So the Motel 6 CHD has been moving individuals and couples into units. There is a delay in getting folks into units because many of them need to get their birth certificates or their driver's license or other forms of ID. And it's not simply putting someone in a hotel room for 2 nights and then transitioning them to an apartment. They then need to get into the system, so to speak, to get the assistance they need to pay the rent of the apartment. I certainly can get some statistics. I also would encourage you to continue the conversation and invite Teresa Nicholson is the director of that site, and she's a wealth of information about the program and moving folks from those rooms into permanent housing. So I would absolutely encourage you. Terry, I can put you in contact with her and have her in.
Yeah, I mean,
but that's the goal for all of these sort of emergency shelters, getting folks off the streets and into some sort of housing. I believe I was at a workshop last year, and I believe the statistic is that it takes about 6 months to 1 year to move someone from the streets into permanent housing. By the time they get their identification, you get them, you identify rental subsidies, you identify an apartment, you identify a landlord that's willing to work with them, that sort of thing. It's not a quick turnaround.
So I thought it was a drop-in shelter for the homeless. I thought that's what it was. So you're talking 6 to 8 months to find permanent housing for people.
Well, 6 to 8 months is the national statistic. Obviously, with COVID, agencies are working as quickly as they can. There's also funds to move folks into permanent housing. The folks that are staying at Motel 6, I believe they came right from the streets, and now they're staying at Motel 6. They've been provided with hotel rooms so that they're not bouncing back and forth between the streets as part of COVID protection. This was all, the Motel 6 and the CHD is all related to the state's COVID homeless outreach. It's not just the standard homeless type initiative. It's all related to COVID and keeping people off the streets and healthy and that sort of thing.
So it's not a drop-in shelter overnight for 2 nights and then gone, because that type of shelter generally has, if you have 2 nights somebody in, and then they're gone. Somebody else takes their place. That's generally what happens.
If I could, I think if we're talking about having a shelter constructed in Holyoke, or constructing a shelter, or hiring a shelter out through the RFP process, or the variety of ways that we've considered getting it done. And again, I really do think that hiring a professional consultant to be able to get community feedback and find an area that would be agreeable to the community and start just there would be a good start. But I think for us, what we have a problem is that, like, the Board of Health and the city gets complaints about folks who are homeless. You know, the Parks Department will call me, and the police department, and say, hey, there's homeless people sleeping in the parks, and there's homeless people, you know, sleeping on private property. A homeowner will call me about people sleeping in the alley or in another place that they don't belong, or at an abandoned building. And yes, the police can shelter them sometimes in their lobby on cold nights, or bring them to this area at Motel 6. But at the end of the day, if there's not a facility for them to go to get wraparound services, to get consultations, to get an idea of what their needs are, and you know, sometimes it's people who have mental illness, who maybe they're off their medication, or maybe they were kicked out of a living situation they had, or maybe they're chronically homeless and it's been a long-term thing. But we don't necessarily have a place that's able to do that does not have barriers to entry. A lot of the shelters, in the sense that I'm discussing, where they're more short-term, there are strings. You have to have some sort of an income, or you have to be, you know, substance free, or you have to be a family, or you have to have children, or there are a variety of ways. And so we run into people who don't meet those criteria, and we have people in the city who are taxpayers who want us to do something about them because they're causing an issue on private or public property. And we don't necessarily have a solution. You know, I don't have anywhere. Our inspectors or the police can ask people, please move along, and these are the services that are available to you. But if there's nowhere for them to necessarily go, all they're going to do is go somewhere else. And so I understand some of the concerns around a shelter, but the base problem of people sleeping out in the open and in places that they shouldn't be is not going to be resolved without some, and maybe it's not a total 100% resolution. I don't want to represent it as that, but we don't have anything to deal with that issue, that symptom that is there. We don't have an immediate answer many times, and there are people who are looking for answers, and I don't have a way to give it to them.
Okay, thank you.
Do you have a correlation between the panhandlers and the people that are staying at the motel?
No.
They're both saying no, Howard.
It might be an interesting statistic.
Councilor McGivern?
I asked for the definition before we started this conversation, and I apologize for my emotions, because I have a lot of respect for both of you. And I understand Councilor Murphy, where he's coming from, and that's why I asked him to define this. But we're getting a mixed message here. You know, an emergency overnight shelter, you know, is one thing. But I'll tell you this, it's not that hard, you know, there's a waiting list, but it's not that hard for someone on an overnight emergency cold weather to be able to use the Friends of the Homeless on Worthington Street in Springfield. God knows how many families from Springfield come to Holyoke when CHC places them in one of our apartments. So there's no reason why we can't collaborate with the city of Springfield for these overnight temporary things at the Friends of the Homeless. Okay, saturation is the point here. It's saturation of not just homeless and not just temporary stuff, but it's an oversaturation of what we can offer as one city. Now, when you look at the people, I know who's under the bridge. I know who's on the other side of the dike, because 3/4 of them are on probation. They're using drugs. They need the services that the police cannot provide. The police can provide a stopgap, a bridge to get people that need the services they do into them. They need to start with a detox, a longer term or short-term transitional TSS unit, and in some cases into 6-month facilities to break their drug habits. That's the services and the beds that we need. Not let's go by the campfire and warm up. Let's get them the help that they really need. Get them out from underneath the bridge. Get them in. And some of those tents down on the riverbanks are the nicest campsites I've ever seen. And Councilor Murphy knows what I'm talking about, because it is an incredible, beautiful spot right there on the river on the other side of that dike. I think Holyoke should be selling out campsites, not homelessness shelters. If we're going to do anything, let's get the state, don't close Providence Hospital to the beds that we need. Open up more beds for people who have substance abuse issues and need places to stay while they detox, need places to stay while they transition into programs. Some don't have to go into long-term residential. Some can do it outpatient. Get them the help they need that way, not the temporary stuff. Only because all we're doing is oversaturating our boundaries, and it just isn't good for the big picture of what we're trying to do, which is break the poverty cycle, get people that into the workforce, and get people productive so that they can do what I think they all want to do, is become part of society itself on a productive level. But we need to address substance abuse, not just the temporary shelters. Do we need a temporary shelter? When a roof caves in, when there's a fire, we've always made do. We've always found people someplace to stay for 2 nights, 3 nights, sometimes a couple weeks. Yes, I agree with that. But we have a temporary shelter with the Friends of the Homeless, and we're taking families from Springfield and beyond. Why don't we trade off a little bit?
Okay, and I think if I can, I'm going to just somewhat wrap this up for tonight anyway. Again, my goal and it connects to various service providers trying to make connections and also trying to get people off the street, was the idea of, yeah, you're not coming here for the next 6 months, but you're coming here, and while you're here, and that's where Alicia and Sean have talked about, a staff that would be making the connections, so that, and that could very well include the police, who have said to me on more than one occasion, we got to find a way to get these individuals, and many of them are on drugs, to get these people where we can get them into a rehab facility, and they resist it when they're on the street. Now, I don't know, and I would be interested to see what the Friends of the Homeless statistics were, or what the statistics are at Motel 6. The advantage to that, as opposed to Motel 6 especially, would be that you'd have counselors, advisors, intermediaries there that maybe could make that connection to get that person to get off the street, to go to rehab, or to go to job training, or whatever the case might be. And I know it's not a perfect world, and I know Holyoke does an awful lot, far more than we probably should. But these are still people that are sleeping on our streets, in our parks. And if we could reduce it by 20%, that's a benefit to the city. And it's a benefit to the image of the city. So, I mean, when I know we first talked about it, and it was just the state coming up with some emergency potential money to help us do this. And I think it was primarily because of COVID, not because of anything else. But again, I would like to find, and Alicia, maybe you can help us, ask Friends of the Homeless if they could provide us some statistics. How many of their people that come in overnight, they're able to provide some kind of assistance so that they get them off the streets and not permanently staying at the Friends of the Homeless. And again, I don't have the answer. I know this has been something we're talking about. I know, I filed it because we had discussions at a public safety meeting, and I said, well, I want to get more information on that. I got some statistics from Alicia, which I asked to distribute, and Holyoke had the second most chronically homeless individuals. Obviously, Springfield was up there the most. And then, it was, the suggestion that I saw was pretty much that you would have a professional service running the facility that is there, not to provide just the shelter, but to provide a transition to whatever the services those people needed, so that they wouldn't be back in the shelter. So with that, I would like, Councilor McGivern, and I know you're not too pleased with this, but if you could, I'd like to table this one more time and just try to get more information. At least if you can connect me to Teresa, so I can get some statistics there, so we kind of see what happened at Motel 6, and we can get some statistics, and you can give me some information from Friends of the Homeless. I agree with Sean. I don't know where we could put one. I don't necessarily see a place unless there was something that was relatively decent shape that could be renovated, but I don't know where that would be. So,
Councilor Murphy, I have no problem with that. I just not too sure everybody's going to want to come back and listen to me. So I'm happy to make the motion to table.
Okay, thank you.
Second.
Okay, motion is made to table, seconded. All in favor?
Aye.
Aye.
Alicia, Sean, thank you very much. I appreciate.
Thanks, Alicia. Thanks, Sean.
And I'm on both of the issues, and I appreciate it. And I appreciate both of you stepping up on the asthma issues. I think we got some significant chances there to make a difference. And hey, if we can improve 10 or 15% of the buildings and the people that live there, and that would be a major home run. And I thank you for your time. So, and please, I will be back, probably getting you back in 3 or 4 weeks. Okay. Thank you. I'll entertain a motion to take up item 3.
Motion to take up item 3.
Second.
Okay, all in favor? Aye. Item 3 is introduced by Councilor James Leahy. Ordered that the Department of Public Works and Suez Water Technologies and Solutions provide a timely plan to the Holyoke City Council regarding street sweeping of city streets in the spring of 21. Try to say that fast. The report should be specific as to when sweeping will take place by neighborhood to ensure compliance with contractual obligations. Last year, a similar order was filed, and it took many follow-ups, calls, emails to get a response. I have been advised that there is an obligation to sweep every street at least once. Verification of this minimum standard and a plan to exceed it for our residents is appreciated and emailed to me as public service chair, but then it got sent to the Public Safety Committee. So we do have Mike McManus and Mike Williams. I don't know if there's anyone else.
Mike Burke is here from Suez as well.
Okay, and Mike Burke from Suez coming here as well. So, I don't know how many mics I can have.
Oh, we got all of them.
Okay, so whichever Mike wants to start.
I'll start. So Mike Williams sent Councilor Leahy an email addressing the city street sweeping program on February 26th.
Okay.
So it outlined what we plan to do. Generally, we start sweeping around St. Patrick's Day. The timeline is affected by weather and equipment availability. And they start on the Homestead Ave, focus on neighborhoods that don't require posting for no parking and other signage, because if you can imagine trying to sweep the streets where cars are parked on the side of the road, it complicates things. Suez did develop a map, and I don't know if I can share my screen.
Jeffrey, can you give him the ability to share a screen? There you go, Mike.
Okay, so do you see the something called the Holyoke Street Sweeping Plan?
Yeah.
So we're pretty much looking at the different wards in the city, and the dates that we anticipate sweeping would be available or be performed in those wards. There is some overlap of the dates if you get down to the nitty-gritty and try to dissect it, and that's because we do need some flexibility with the street postings for no parking. But this is our outline. This is it's available on the DPW's website right now. It's on the main page of DPW's site off of the city's website.
Okay.
We have the street sweeping plan, and as we get into street sweeping, we'll make updates to this map. We'll post the map here for people to be able to see where we are. And another thing that Suez and the city are going to try to use is the Everbridge system to make local notifications to residents saying, you know, we're going to be in your neighborhood tomorrow.
Yeah, that's what I was going to. One of the things I was going to suggest, because that's starting to work good for the trash, and I think it'll help.
Yeah,
notify more people.
They tried it last year, and you know, I think Mike Williams will say that it was hit or miss, that there wasn't full compliance with it, and they still had to post.
Yeah.
I think one thing we've noticed with the trash and recycling is that there have been more people subscribing to Everbridge to get the notices.
Yeah, we try to promote that out there at city council meetings. So.
Yeah, and certainly on your own Facebook pages and other ways, just to get people to know that they can sign up for the service to get various notifications, not just for street sweeping or trash and recycling, but I think even the Board of Health used it for COVID updates last year. So that's how we're going to try to improve communications. That's our plan. Part of the order kind of commented to last year. And last year, I think we're right in the middle of COVID, at least the beginning of COVID. I know we celebrated the 1-year anniversary for the state of Massachusetts being in a state of emergency. I know DPW, when that happened, we went into our emergency operations. We shut everything down. We went to half crews, and we rotated those crews 1 week on, 1 week off. And our primary goal was trash and recycling collection. It was a good thing we had a light winter, because we didn't have anybody to fill potholes at that time. And I know Suez was doing the same thing. You know, they were in an emergency mode, and their primary focus was operating our sewer collection system in the wastewater treatment plant. And that's why there was a lag with the street sweeping. It wasn't their fault. If we weren't in COVID, I'm sure it would have been a normal year for them, and there wouldn't have been any question about streets not being swept. But I think we're past that.
Every street does get swept once a year, or
yeah,
minimally, I assume.
Everything gets swept at least once a year. There's a lot of streets that get swept, you know, 30+ times a year. There's other areas that get swept regularly twice a year. They do sweeping as needed. If we call them out, they'll do sweeping. If they're just driving around, they notice themselves that, hey, this area needs some attention, they'll send the sweepers there.
Okay. Councilman Gurley?
Thank you, Mr. Chairman. Michael, and Michael, thank you for being here. Years ago, I was part of some city councilors and the DPW introducing the concept of allowing, at the time was Aquarion, if I'm saying it right, to take over the street sweeping for the cities. And I understand, you know, tonight's about scheduling and notifications and communication, but I would like to talk a little bit about, and maybe you guys can help us out, is why it's important for the streets to be swept, not just because we like clean streets and clean neighborhoods, but whatever we let into the storm waters in terms of material becomes part of not just the sludge, but becomes part of what we have to remove from the treatment plant itself. Am I correct?
Generally, yeah.
It can happen because, you know, at the time we originally started doing it, there weren't, you know, it was mostly combined sewer. You know, the CSOs were prevalent for everything that went down towards the treatment plant itself. I know we've separated a lot of stuff now, but we're still an older city.
But Suez still sweeps in areas where there aren't any sewers. They sweep all of West Holyoke, and there's no sewers in West Holyoke. So it's for collection system maintenance, sewer collection, but also storm drainage. There is some capacity in the catch basins for material to collect before it goes into the sewer and combined areas. And it's also I think it's a state law that you have to do street sweeping, that you have to keep track of this extra material so that it doesn't wind up in the water bodies and rivers like you're alluding to, Joe.
And if we get it with the street sweeper, it might be a little bit less expensive than getting it at the wastewater treatment plant. Does that make sense?
Yeah,
I
see Mike nodding.
Yep.
Yeah.
It protects the downstream equipment, you know, it really prevents it from going through the system and, you know, abusing the equipment.
Sand does a number on pumps.
Yes.
The pumps are designed to pump water, not grit. And any grit that gets to the treatment plant is pretty much removed and winds up in the sludge that needs to get disposed of somewhere. And it's cheaper to dispose of it as street sweepings than it is as wastewater treatment plant sludge.
And Mike, when I wore a younger man's clothes, we used to have that went around the city with the storm drains, the catch basins themselves. We called it the claw. Do we still have a claw that cleans out the catch basins?
Oh yeah.
It's probably, is it the same one, Mike Burke?
It might be a little newer, but yeah, it's the same catch basin clam truck that's utilized around the city. Yeah. We clean approximately probably 900 to 1,000 catch basins a year, and there's well over 3,000 within the city. Yeah.
So about a third a year.
Yeah, yeah, and we're required to clean a certain amount. We do go above that per our stormwater permit with the city. Same goes with street sweeping, where we have to sweep certain areas of the city as well, more than once per year, spring and fall. And typically the street sweeping, we do the entire city once per year, like Mike McManus was alluding to. We do the inlets, the outlets, we do the main arteries within the city for aesthetics, something that's been done for long before I was around. So it's an ongoing process. Sweeping is something that we do as soon as the weather clears. We get out there, typically, like Mike said, at the St. Patrick's Day Parade. We'd probably already be out there now cleaning and have a good portion of the main roads clean, the parade routes, the road race routes done. But you know, this year, being that there's no road race or parade and the snow melt is just really kind of coming off the streets, we'll be out there shortly, I'm sure. Probably in the next couple of weeks we'll get a jump on it.
I think it's already started. On my way to work downtown this morning, I was going down South Street, and one of the biggest street sweepers I've ever seen was coming right up South Street at me. Is that a new vehicle?
Which one was that, Mike Williams?
That would be the Pelican. Yeah. So that's the newer of the two, Joe.
Well, it's impressive. Let's say that.
We're out there. We started. We got we've done some of Northampton Street, some of Route 5, some of Main, Resnick. We're out there doing the normal inlets like Mike just mentioned, and we got one sweeper out there right now. The other one's in for service, and we'll get on it.
So pretty much.
Just make believe the festivities are still going on and get out there and get it done.
That's it.
We are having a virtual road race. The shamrocks are up, and people just have to run at their own time. But the people are going to be out there, you know, not as a collective crew, but you know, in their own time.
Yeah.
The runners.
Yep.
So, Mike William, you have two sweepers?
That's correct.
Okay.
Yeah, and if anytime we have a breakdown, you know, of a sweeper and we need to get things moving along quicker, we do have a contractor that we can bring in to substitute that. So, and we actually have a company that we can lease a sweeper or rent one from to substitute for that as well. So.
Okay. And is it possible, either Mike, to maybe send an email with that map with the dates that you had on that to the city council? Would that be possible?
Yeah, we can do that.
Yeah, because I think then at least each counselor would have an idea of when things are going to happen. Now, as I looked at that map, I mean, there were like for Ward 5, I think it had, I'm going to say about 20 days listed there. Obviously, you're not there every day, but is that like you're going to be doing Ward 5 during that period, but not necessarily every day during that, or are you doing it every day during that period?
It's not every day during that exact period. It's that period to identify the start to finish timeline, which will complete that. But for certain wards, we have particularly your ward, you can do a lot of non-posted, but you do get into South Holyoke, and there's a lot of posting in that neighborhood. So just balancing, certain streets, you can't post every street at once. So just balance. We post some in your neighborhood, and at that time we might be moving on to Ward 2 or 3 at the same time, posting in different areas of the community.
Yeah, and I know we speak. First of all, obviously parking is pretty tight, and you got a lot of cars on the street, and it's very difficult to get them all off the street to sweep. So I appreciate what you can do, but obviously, even if we ended up trying to go just clear that one side as best you can, and maybe I don't know how to do it differently, but somehow getting that announcement out. But maybe this communication system with the city, maybe we get more people to be aware that we're going to get our streets clean. We got to move over. We might get a better compliance, and it might end up being a better job. And I'm not criticizing you on that. It's just the reality. People are not moving. I know. After we talked last year, I went down and looked, and they were still parking there. So,
yep.
You do the best you can. You try to get as many people to move over as possible, and just do what you can. But I think if we got the map in that schedule, I think that would be good. And maybe Mike, just a summary of the streets that are, or the arteries that are getting done more than once, and what kind of schedule that might be. And if there are others that every now and then you have to come back for whatever reason, just so we can give a full report to everybody.
Sure, that was all in the email to Councilor Leahy, so it'll be easy to summarize that.
Okay.
And we can forward it to Jeffrey, and he can.
Yeah, and he'll forward it to us. Yeah, that'd be great.
Okay.
Yeah, and I believe that the GIS map can be updated as to which streets have been completed, or which wards have been partially completed. So that could be posted up there as well.
The other thing, and this is just now that you mentioned this is another way of potentially getting more communication. And I don't know if this could work, but as we go to city council meetings, so we got a city council meeting this coming Tuesday. I mean, if you knew you were going to be doing certain streets, say after the 18th or whatever, we might be able to make that as an announcement. But I'm amazed at how many people watch our meetings, but there are a lot of people that watch the meetings. We might be able to say, street sweeping on these streets is going to take place sometime in the next week. So be aware that, you may be asked to leave the street open so that they can get through. I don't know if that would work, but I think if we did that, if you could send that to us, I'm pretty sure we'd be willing to announce it. And then that's an extra notice that we're coming to clean your street. So please help us out. Just a thought. I could always have Councilman McGivern announce it.
Mike McManus, where on the website do you find the map?
If you go to the DPW page on the website.
I got that. I'm not that bad, Mike.
So you see where it says sign up for the city's emergency notification system, trash and recycling update, bulky waste drop off, and then right underneath that is the 2021 street sweeping plan.
Thank you.
But Mike,
it's an incredible website with a lot of information. I think it's I know it's developed over recent time, but we're putting it together. But the information you're putting in there is tremendous.
Yeah, I think the more information we provide, the better off we are. So, but we got to make sure we get it out in all kinds of forms. So Mike Williams, if that's possible, if you know what you're going to be doing in the next 10 days, if you send it to us, we'll, I'll gladly, and if no one else announces it, I'll announce it, because we do have, President McGee could announce it as well. So just so that that those people living on those streets know that you're coming and this is what we should be expecting.
Yeah, and it's all weather dependent and breakdowns, of course. But I think we can share that information.
Yeah, I just think it would, it's another avenue to get as much compliance and as much cleaning as possible. And
my only concern with that, Councilor Murphy, is to give 2 weeks worth of streets that we anticipate sweeping is a lot of streets, for one thing, and it's not a specific day. So what we found with this trash and recycling was people want to know exactly what day are we going to pick up their trash. And when we were behind, I couldn't predict a few days ahead where we were going to be exactly, and I was hesitant to provide any guarantee that on this exact day we'll be at your house. So we could push updates to DPW's page, to our Facebook page, that other people can grab and push out on more daily or 2-day notifications.
Okay, that's fine. I mean, again, I just think the more information we provide ahead of time, the better off the response is going to be. And obviously the better off the cleaning is going to be, because if you don't have cars blocking you and you're not having to move around everybody, you're going to be doing it quicker and I would think more effectively. So,
right.
Councilor McGee, Councilor Graney, all set or?
No, great information, and I think it's exactly what Councilor Layton wanted.
You all set, Councilor Graney?
Yeah, I'm all set.
Okay.
Make a motion. The order's been complied with.
Okay, make a motion.
You gotta get Councilor Murphy to report something out, Councilor McGee, right?
Oh boy.
Give him a list of 80 streets to report.
We'll do a show and tell with the map.
Sure.
All you Mikes, thank you very much. And Mike, we managed to get one more, but it's going to be real quick. So
good.
And Mike and Mike, well, thank you very much.
Thank you guys.
Thank you guys.
Good evening.
Thank you.
And the last, I'll entertain a motion to take up item 4.
Make the motion to take up item 4.
Second.
All in favor? Aye. It's ordered that a traffic study be done on Sargent Street observing the traffic between St. Jerome and Sycamore. Residents have mentioned several accidents in this area, possibly due to speed and obstructive views as vehicles travel around the bend. They have suggested a 4-way stop that may be helpful at either Magnolia or Sycamore. We had tabled this in September, and Mike, I know Bob sent me an email. If you can just convey what the thought was.
Sure. So we've set up the camera that we have to record traffic flowing through this intersection, and we have some data for that. I wanted to take a holistic look at Sargent and West Franklin Streets, and the DPW made a request for crash data along both of those streets. We got a lot of information from the police department, and we didn't take a look at it until recently. And then when we were looking at it, it looked as if there might have been a gap in the data that we got back from them. So we've requested some additional information very recently. We haven't gotten that yet. But the crash data plays an important role into warrant analysis for stop signs and multi-way stops, as does traffic volumes. So we're kind of asking if we could get another month to get more data. And
I suggested to Bob that we might do it on the 31st. He indicated that might be okay.
Yeah.
I said either that or a meeting in April, but that would be 3 weeks or probably 6 weeks. But he thought he might have it in 3. But if you think it's going to be better with 6, I can do that as well.
I mean, more time is always better.
I'd say give them more time. It's been really busy for the DPW. Give them more time.
So what we'll do is we'll end up tabling this, and we'll come back the meeting in mid-April, and by that time you'll have the accident reports and pretty much give us a recommendation if there should be a stop sign, where they should be, and the accident report, as I understood it, was quite a lot of information.
So we got a lot of information, but then when we were looking at it, we weren't finding a lot for these intersections.
Okay.
So that made us think that maybe there was a gap and we needed to request additional information.
Well, if you tell us what years, the gap is when the police did away with the traffic bureau.
Well, we only requested the last 5 years worth of data.
That's when they did away with the traffic bureau. Mr. Chair, I suggest we table it and use your discretion with Mike about when the next meeting can be.
Okay, hang on for 1 second. I got Councilor Graney.
You hit 09 by mistake, Council Murphy.
Okay.
Hello?
You're all set?
I hit it by mistake. Yeah,
Okay.
I'm all set.
Okay, thank you. So the motion is made by Councilor McGivern to table. Is there a second?
Second.
Okay. So Mike will do this. It'll probably be like the second or third week in April.
Okay.
I won't put it at the end of March. All right. All in favor of tabling?
Aye.
Aye.
Opposed? Okay. And we entertain a motion to adjourn.
Motion to adjourn.
Councilor, quick question.
Yep.
Good night, everybody.
Night.
Item 3, you have complied with. The order was actually adopted and just copied to public safety. Would it still be reported out as complied with?
That's a good question.
Yeah, I think if I could, Mr. Chair, I think, Jeff, that's a good question. I think when something's copied, it's more for informational, and if there's a discussion, the committee can report out that it was complied with. We had a discussion.
Okay.
Correct.
But we can't take, we can't recommend final action other than what we did.
Just the information and comply. Okay. Motion to adjourn.
Aye.
All in favor? Second? Again?
Thanks,
We
guys.
said second already. There's a second.
No, I think I did the third second.
You guys are going to get a third. You keep it up. Thanks. Have a good night.